Hello, I'm going to tell you about medications for treating Peyronie's disease. And it's really great that you bought this guide. Well done. Give yourself some praise right now, because this guide will help you not only to distinguish between medications yourself and understand them, you can also keep any doctor in check. Believe me, guys, there are plenty of fools who handle Peyronie's disease very poorly. First. Second, there are a lot of tricksters and so-called experts who, for a lot of money, and I know such clinics, usually in the capital of our country, use completely ineffective methods on you, and well, they start the process, and in the end, they end up giving you implants at a high price. On the one hand, they take your money for the treatment, and then again for the implants. It's very convenient, really, as a businessman. Respect. But of course, their personal qualities leave much to be desired. The question is, where will that money go? What good will it do? But that's their personal business. In any case, I'll tell you what you definitely shouldn't use. And I'll tell you about the medications I use myself. In principle, you could of course take them without a doctor. I don't really understand why some people do this. Well, give it a try. Just in case, I want to warn you that Peyronie disease never occurs as a standalone illness. It's always a part of the patient's overall health condition. And first. And second, Peyronie disease is never just a plaque. It's always a process, a predisposition to plaque formation, which may develop into a plaque or may not. And thank God for that. Or it may develop into several different plaques. So, well, try the medications on your own if you can't see a doctor, if you can't afford, for example, the treatment, or if for some reason you can't get an appointment. In principle, if I were to use any highly toxic medications, I would tell you about them. But of course, as a doctor, I must say that you absolutely should not take these medications without a doctor's prescription. Do not take medications without a doctor's prescription. Understood. So the first medications I want to talk about are collagenase preparations. This is an expensive medication and it is banned in Russia. The idea is that it is injected into the plaque and then the plaque is broken up. Why is it banned in Russia? It's not because we're some backward, foolish country and all the good things are forbidden to us and we only get the really bad stuff. No, guys, collagenase is banned here because we have the best urology in the world. Our leading urologists are major stars, brilliant and intelligent people. And they banned collagenase for two reasons. First of all, a plaque is not always made up solely of collagen. Very often, it's composed of calcium, calcium salts, and even bone formation. It's a very tough structure, and not every collagenase can destroy every plaque. That's one. Furthermore, during the process of breaking down such a plaque, damage occurs and the plaque tends to reform in the same spot. And collagenase costs an insane amount of money. That's why our smart guys thought it over and decided to ban such a questionable technology in Russia. The next drug is diprospan. Diprospan is a hormone medication from the steroid group. It's the same kind of hormone as prednisolone or dexamethasone if you know anything about those. It's used to treat allergies and joint problems. These are exactly the kinds of hormones that are harmful to your health. Everyone knows that hormones are harmful, so diprospan belongs to this group of hormones. It's used in cosmetology and it's often used in surgery to break down plaques. It actually breaks down the plaque pretty well, but during the injection it only works when injected directly into the site of the plaque. So during the injection into this area, are we damaging the tissue or not? Well, of course we're damaging it. It's an injection, it's not just some trivial thing. Both the injection itself and then the administration of the medication. And this can lead to inflammation, and very often it can also provoke the plaque itself. But why would we want to provoke it when we have plenty of other good treatment? I'll talk about those later. And there's another method that was presented at one of the congresses I attend. Our guys, our urologists, completely tore it apart. Andrei Zenovich Vinarov completely trashed this method. Well, in my opinion, they still work. This is the injection of blood plasma into the penis with the aim of improving everything, including the plaque. Guys, it doesn't work. Seriously. Maybe you'll feel a little bit better, but if you just want a slight improvement, then that's all you'll get. A slight improvement. But it's not worth your money, it doesn't cure Peyronie's disease, and it doesn't break down the plaque. Is that clear? Now let's talk about medications that we take orally, or so-called oral medications. And first on our list is a very old long-standing drug. It's called verapamil. And it's believed that verapamil, which is a calcium channel blocker, is supposed to reduce inflammation, dissolve the plaque, improve erections, and do a lot of other good things. In reality, it doesn't really do anything particularly good. You can take it or not take it, but of course, not without a doctor's prescription, understood? Now, I'm speaking to those who always take everything without a doctor's prescription, who don't follow any rules. So, this medication doesn't make much of a difference and never will. I rarely use it in treating my patients. The second medication is pentoxifylline, also known as Trental. With this medication, the dosage is very important, and the greater your body mass, the higher your dose should be. The dose must be appropriate. This medication is good. I use it often. I don't use it to treat Peyronie's disease itself, but rather to improve the overall health of a man who has Peyronie's disease. I use it to help medications reach the male reproductive system. Overall, it's a good medication, but in this case, it's absolutely unnecessary. To put it simply, it won't cure Peyronie's disease, but overall, it's an excellent medication. I use it in my practice. The next medication is tamoxifen. Tamoxifen is an anti-estrogen drug. Its main function is that it blocks the production of estrogens and as a result increases the level, and it increases the level of luteinizing hormone, which in turn raises testosterone levels. All of its effects are based on this. It's also believed to improve potency due to the increased testosterone. Remember that? It reduces pain, again thanks to the higher testosterone. Remember, we need those fights. And moving on. Does it reduce the plaque itself? No, it doesn't. Can it make it bigger? Of course, testosterone can make it bigger, but can it not make it bigger? It can, because it reduces inflammation. That's why tamoxifen is kind of so-so. This is a drug that fitness trainers really like to mess around with, and for that, guys, I strongly disapprove. You can't just mess around with serious hormonal drugs like that. You can't just swap out the conductor in an orchestra like that. There's no guarantee he'll play well. That's why I absolutely do not recommend using tamoxifen or messing around with it like that. You might end up messing around so much that you'll seriously regret it later. I prescribe it extremely rarely because if I need testosterone, I work directly with testosterone since, well, the body needs estrogens. I wouldn't block estrogens or do all sorts of tricks just to stimulate testosterone production. All of this is popular among guys whose biceps are bigger than their heads. If you want your biceps to be bigger than your head, then go ahead. But in my case, my head is bigger. I think it's better to live smart in this life, not just strong. So this medication is both strong and smart. And now we move on to the group of the most effective medications. These are the ones I prescribe almost always, in different doses, with varying frequency, and using different protocols for my patients. The primary medication for treating Peyronie disease, guys, is Peraflex, the medication Peraflex. It can be considered a dietary supplement. The thing is, a doctor's understanding, well, my understanding of a dietary supplement is very different from how a grandma on a bench or other patients or a fitness trainer might see it. I only work with a dietary supplement if it gives me a specific, controllable, and consistently clear result in patients. In that case, I don't care whether it's a supplement or not. I'll use it as a medication if it works for me. If it's something unclear, then it's better not to use it. I don't use any other dietary supplements to treat Peyronie disease. But I do use Peraflex. And for me, it works quite well. It's a well-proven, reliable medication. No one pays me for advertising. They could pay me honestly. I really like it and prescribe it often. The next medication that also works, and again, I'm not paid to advertise it, and it's also highly effective, is Longidasa. The medication has a resorptive effect, and it gradually, little by little, over a long period, dissolves the plaque. We always start with intramuscular administration of Longidasa, and I prescribe 3,000 international units intramuscularly, either every other day or once every 3 days, for 5 or 10 times, depending on the extent of the lesion and the patient. Still, treatment is always individual, guys. But if you are a typical patient, 5 to 7 times of Longidasa every 3 days should be enough for you. And then Longidasa is prescribed rectally as suppositories for 3 months, once every 3 days. And on this basis, with Longidasa as the foundation, I then build my main treatment. The drug Peraflex is also prescribed for a long period in the standard dosage for up to 6 months. We always give Peraflex in the standard dosage for everyone. The next drug I work with, which I like and which has proven itself well in the initial stage of Peyronie's disease, is Contractubex. This is a gel that, when used properly with the male vascular system, is quite well absorbed through the skin and actually reaches the plaque. This is something you can achieve and something you should aim to achieve. If you just start applying Contractubex, you won't get much of an effect because it needs to get there. And, well, it has to reach the plaque through the skin, right? And if you think about it a bit medically, I may have offended you, I didn't mean to, but you really do need to think about it. It's actually quite difficult for a medicinal substance to penetrate even a centimeter like that. There are blood vessels, nerves, lymph flow, blood flow, all these arterioles and venules, everything is being carried around. And for it to reach the plaque, you really have to make an effort. So when used correctly in combination with physiotherapy methods, and I'll record a separate video about those, in combination with physiotherapy methods, it works quite well and actually helps dissolve it. Let me remind you, this was the drug Contractubex. And the next medication that I almost always use is tadalafil. I usually use it at a dose of 5 milligrams as a rule, unless there are other considerations. I use it for a long period, up to 6 months or even a year, and I use it to improve blood circulation in the tissues so that the tissues start to live, so that they come back to life. All of this is used as part of a comprehensive approach. Treating only Peyronie's disease alone is unlikely to give you results. I want to warn you right away because Peyronie's disease is just one part, a part of a whole system where we encounter other various pathologies, which I will discuss in a separate guide. And treatment should at the very least address and restore everything. Only then will you achieve results. Trying to put out a fire on just 10 square centimeters is pointless. The fire will come from any side. That's all. It was a pleasure. I will be very glad if my recommendation helps you. All the best.